LaTanya Gilchrist knows diabetes, and not in a good way.
Diabetes has been in my family since I was a little bitty girl. All of my siblings, my parents, both of them, my mother and father, especially on my dad's side, all of his siblings and his mother and father both, all of them had diabetes. I think the hardest time for me was watching my dad's brothers and sisters pass away from diabetes complications.
Diabetes is the 7th leading cause of death in North Carolina. It increases your risk of a heart attack or stroke. It can cause blindness, loss of limbs, and nerve impairment. And it can also cause kidney failure.
Diabetes is actually the #1 cause of kidney disease, not only in this country, but actually in the world.
The number one cause of kidney disease
is diabetes. And actually the most common reason for someone to actually undergo dialysis, or what we call renal failure, is diabetes.
In fact, since 2011, diabetes has caused 44% of all kidney failure in the United States. Dr. David Ortiz-Milo is a kidney specialist at Duke University Medical Center. The key speaker at this workshop, sponsored by the Durham Diabetes Coalition and the Durham County Department of Public Health. His message is simple. If you're diagnosed with diabetes, take action.
You have to embrace whatever disease you have. Some of these diseases, when you are diagnosed, is life-changing, and you can be on denial. And that's probably one of the worst mistakes you can make. Once you are diagnosed, seek help.
But that's the problem. People don't want to have a life-changing illness forced on them. After watching her family members succumb to complications of diabetes, LaTanya Gilchrist herself was diagnosed.
It was really hard to deal with at first, and it was very scary. There was a lot of fear, there was a lot of denial. I didn't want the disease, and my dad used to say, I really don't want this to happen to you all, but it seemed to be genetic and seemed to be happening to everybody. So we had to find ways to cope with it and to change our eating habits, change our being so sedentary, had to get up and get moving, get exercising, and definitely eat right.
Eating right is critical because diabetes is linked to how we use food for energy. When we eat, that food is turned into blood sugar or glucose. But to get into cells and deliver energy, glucose needs a hormone called insulin that unlocks the cell. In type 1 diabetes, the body cannot make insulin. It usually strikes children. Only about 5% of diabetics have this kind. The type 2 diabetes usually comes on later in life. People can still produce insulin, but it doesn't do as good a job getting glucose into cells. That can leave too much glucose in the bloodstream. And if the amount gets too high, you can go into a diabetic coma, a life-threatening condition. Diabetes in Durham County is a mixed bag of statistics. Overall, there's less diabetes here than some other parts of the state. But not everyone is affected equally. African Americans, Hispanics, and American Indians are more prone to diabetes than whites, and those with lower incomes and less education have higher rates as well. But thanks to community efforts, Durham County offers a wide variety of support and resources for those diagnosed with diabetes.
The support aspect of dealing with chronic illness is a huge component to diabetes management because they're not alone. Oftentimes they feel like it's just them. Oftentimes they feel like no one understands, but we have a support group that meets every Wednesday at CARE, and they come together. They're actually here today, and they're excited about it. They are more motivated, and they're like, yes, I'm not by myself, so it's great.
CARE is Healing with Care, Durham's first freestanding free health clinic. They offer exercise classes and a workout gym, along with free health screening and counseling. As well, Durham County and the Durham Diabetes Coalition offer in-home patient care.
Our mission really is to move the needle on diabetes here within Durham County. And we're doing that in a wide variety of different ways. We're doing it through clinical home visits where we go out and send out a clinical team with a nurse practitioner, licensed clinical social worker, nutritionist, and community health worker to actually meet people living with diabetes within their home and help them to work on self-management plans to improve their diabetes.
But with our supersized world, it's tough to resist the temptation to eat things that aren't good for us. Many packaged foods, stripped of fat, are now chock full of sugar.
It's probably one of the biggest challenges that we're facing because it's a cultural thing. So we are living the moment of everything big and oversized, everything with sugar. So it's a huge challenge.
When it's offered to us, sometimes we try to find a healthier alternative to it. You know, it may be spread out on the table for you to try, but you know, we're learning how to portion control. And where you would get a big slice of cake or pie, you may cut it in half and share it with another family member or person.
And experts say talk with your doctor about different ways to manage diabetes because it is not a one-size-fits-all remedy.
One person may be able to manage their diabetes through lifestyle changes, the nutrition habits that they have, and being physically active. Another person may need to be on an oral agent to help manage it, and insulin may work best for others as well. So really finding out what works best with you and having that good relationship with your provider and asking questions. That's important also.
So what are the symptoms of diabetes? Well, feeling very thirsty or hungry, extreme fatigue, frequent trips to the bathroom, blurry vision, cuts and bruises that heal slowly, weight loss, and tingling pain or numbness in the hands and feet. If you experience these symptoms, ask your doctor to test you for diabetes.
So once you are diagnosed, it doesn't stop there. You just don't take it one appointment after another, but rather embrace it and make sure that diagnosis will change your life in a positive way.
Although it may be hard to see the positive in being diagnosed with diabetes, remember, we're not alone. Nearly 1 in 10 North Carolina adults has diabetes, and county health officials all across the state are working hard to help everyone with diabetes manage their disease.
It's very important you know that you're not by yourself, and there's a lot of resources out here that are here to target the issues that your doctor's telling you to address. Just know if you're struggling with resources and you know how to start, there is help.
It's help that LaTanya Gilchrist knows well. Also a breast cancer survivor, she's not only living with diabetes, she is living well. Her secret? Embrace the diagnosis, change for the better, and live life every day with courage.
You can live well with this disease. So I encourage people not to stop, but keep going and learn all you can and do not give up.